Okay, ma'am. Kamarabad start, ma'am. First question is the antagonistic and anticoagulant direct and indirect actions. First of all, coagulant, coagulant used epiexibins, revo, revoroexibin, endoexibin, and betraexibin used for the protection of thrombosis in survival, cardiac contact, and treatment and preventing the metabolic events. And antagonistic, the most common oral anticoagulant agent are vitamins K antagonistic such as the warfarines and phenophrine are common ones. And next question is the fibrinolytic drugs. Fibrinolytic drugs are used to break down the thrombus in information of clot, clot formation in injury. Sometimes patient develop a injury and fibrinogens are used to remove the thrombocytes and thrombins in our injury place to break down the thrombus within the common agent like a streptokinase and urokinase and LT places are also used. And next question is third question, mechanism of fibrinolytic activities in fibrino lysis of fibrin clot that the product of the coagulation in breakdowns. It means enzyme plasma act the fibrinomatch at barrier plugs leading to production of the circulatory fragments that are cleared by the another proteins by the breakdown by the kidney and liver. Mechanism of fibrinolytic activity is the basic for the fibrinolysis. Breakdown of fibrinolysis, a fibrin clot, the product of the coagulation is breakdown. Next, next question is features of the action of tissue activator porofibrins. Fibrinolysin is also related to the prostatic gland, secreting gland. Both are helpful for the clotting of the blood. And the prostatic gland secrete a thinny milky fluid that contact the calcium site, calcium citrate ion, phosphate ion are collecting and fibrinolytics also. And the main factor of the fibrono in mostly in female in time of pregnancy is most this factor can most helpful. Profibrinolysis also is the vaginal secretion of the are acidic female are acidic in development of ejaculation. The sperm are very sensitive in the acid and basic media. And five question is induction for use and side effect. The common side effect of fibrinocytic agent are the hypersensitivity reaction and bleeding. The fibrinoblast or fibrinocyst or fibrinolytics cannot proper function. The bleeding cannot stop early is common side effect. And sixth question is inhibitor of the fibrinolysis is the common name is the barrier of fibrinolysis. The fibrinolysis factor that inhibit antiplasmin, antiplasmin enzyme and anti-activator play an important role the regulation of the plasma fibrinolytic activity and many modifying a response to the fibrin deposits. The inhibitor of the fibrinolysis is the activating the fibrinolysis is enzyme is called plasmin enzyme. They activate the function of the fibrinolines and the common sense used to use antiplasmins and to to restrict and inhibit the function of the fibrinolysis. Okay, ma'am. Next Hassan Khan.
नेक्स्ट मैं इसमें आ रहा हूँ.
Next Hassan Khan.
ठीक है ठीक है. अभी तुमने सुनाना है.
हाँ हसन खान तू सुना. मैम कह रही है.
हाँ हाँ मुझे पता है. ओके मैम. फार्माकोलॉजी 1.4. Traditional and anticoagulants have antinodes. Heparin can be neutralized by protamine and warfarin. Warfarin anticoagulations can be reversed by vitamin K injections, and injection and oral anticoagulants. Contradictions was defined as a presence of one or more of the following: severe chronic blood urticaria, intracranial mass, intracranial hemorrhage, severe and major gastrointestinal bleeding, and end-stage liver disease. Fibrinolytic agents are used to break down the thrombus, with the common agents being tenecteplase, reticulase, and altipase, streptokinase, and urokinase. Common side effects of fibrinolytic agents are hypersensitivity reactions and bleedings. Question number 3. Answer number 3, ma'am. In fibrinolysis, a fibrin clot, the product of coagulation, is broken. Its main enzyme, plasmin, cuts the fibrin mesh at various places, mm, leading to the production of circulating fragments that are cleared by other proteases by the kidney and liver. Answer number 4. Tissue plasminogen activator is a protein involved in the breakdown of blood clots. It is a serine protease found in the endothelial cells, the cells that line the blood vessel. कहाँ चला गया? Blood some sides blood vessels that line in the blood vessel. TPA is a thrombotic formed by the aggregations of activated platelets into the fibrin meshes by the activating plasminogen. More specifically, it cleaves designogen, plasminogen, and as its AGR561 to VL562 peptide bond to form the serine protease plasmin. Answer number 5. The drug is used to treat mild to moderate pain, headache, menstrual period, toothache, bronchitis, urticaria, cold flu, ashes, pain, and to reduce fever. Some side effects are the minor or the little concern, while others may be severe, requiring medical attention. Although many side effects are minor and not harmful, it is important to let your doctor know as the side effect may be
मैम लेफ्ट कर दी. हेलो.
रुक जाओ, सबर करो.
हाँ तेरी आवाज की वजह से गई है मैं.
हमको अपना खतरा पड़ जाएगा ना।
नेक्स्ट नेक्स्ट अहमद इकबाल।
जा दफा हो जा बहन, किसे सुनाएगा तू?
अच्छा, इसका यही कहना है कोई एपिसोड नंबर 8 का आ गई मैम नहीं आई।
नहीं आई
मैम
अभी,
को
रुक
मैडम
जा।
सब
आई,
मैसेज करना।
मैडम आई तो
यार
कहना सबने सुना दिया।
ओए नेक्स्ट अहमद। हाँ यही कह देंगे।
तो सत्य
मैम ने
ने सही
मैसेज
कहा।
किया नेक्स्ट। और नेक्स्ट अहमद का कहा है?
आने
अहमद
दे
क्लास
मैम
में
को,
नहीं है।
मैम को तो आने दे।
कुछ नहीं होता, हम बैठे नहीं है। सन।
तो फिर ज्यादा जल्दी है। तू दो दो चिपड़ी खा रहा है, एक से ही जाएगा। अंडे खाता रहा वही ठीक है, मुर्गी खा लेगा तो फिर अंडों से भी जाएगा।
हाँ वॉशरूम में।
नहीं यार, तू बता, एक ही मेरा मसला है, हैंड फ्री फिर नहीं ली थी, 3 दिन बाद फिर खराब। हालांकि 400 की ली मैंने, 3 दफा 400 की ले चुका मैं। लेकिन वही मसला है, हफ्ता चलती है फिर खराब हो जाती है। क्या करें। मैंने तो समझा शायद तूने एक दो बार ड्रेस लिया, कुछ टीसीएस भेजेगा कुछ।
हाँ भेजता हूँ डंडे के साथ। डंडे वाली एक हैंड फ्री है, उसका
अच्छा
एक ही ढक्कन है ऊपर।
अच्छा, एक ही ढक्कन है, बाकी
इसके पास
सब।
वही है।
हाँ, इसने वही तो ली हुई है अभी।
मैं तो बगैर हैंड फ्री का यूज कर रहा हूँ।
नहीं, उसने।
अच्छा वाला मोबाइल ले लेना।
हाँ, तो एयरपोर्ट लिए मैं ना दूसरे बगैर
नहीं
डंडे के
बगैर।
साथ।
ओए अहमद शुरू करे, मैम कह रही है मैसेज पे।
हाँ, चुप करके बैठा रहे।
नहीं मैम के यार इंटरनेट चल नहीं रहा उसका, तू खुद से किए जा रहा है।
सामत ऐसे करे जिसने पास बैठा हो, चेक कर रहा इंटरनेट।
सामने तो कॉल पर बात होती है ना डायरेक्ट। क्या सामने मैसेज नहीं करता,
सामा
स्टाफ
ऐसे
वालों
है।
को डायरेक्ट कॉल करता है।
सामा पाकिस्तान से भी ट्रैक डाल ही कर रहा हूँ।
इतना टाइम नहीं होता ना।
ये सही
यार
है।
अब क्या करें।
हम मैसेज कर करके वैसे ही है चेंज हो गई होती है ना।
कमर तूने सुना दिया
चलो
ना?
क्लास लेफ्ट
हाँ
करो यार,
मैं
मैम
लेफ्ट
नहीं
कर
है,
दिया।
चली
हम
गई है
तुम्हें
मैम।
मैम।
और मैम कह रही है मीटिंग ऑफ।
और
सवाल या निशान आगे।
वैसे भी
आगे
3 हफ्ते
सवाल या
यही
निशान।
टॉपिक सुनाने हैं।
मैं आगे दो 3 हफ्ते
कर दे लेफ्ट।
करो लेफ्ट, मैम का नेट ही बंद हो गया।
चलो फिर ठीक है, ओके अल्लाह हाफिज।
आगे भी प्रैक्टिस क्लास में कब तक जान छुड़ाओगे बैठ कर।
फिर मैं वॉशरूम करके आ रहा हूँ।
अगली 2
हैंड
प्रैक्टिस क्लासों में ना
हैंड फ्री
1 मिनट
उतारने जा
पॉज
रहा
होगा।
है।
मोबाइल रख के जा रहा हूँ।
हाँ, वो तो लगी
हाँ
रहता
ले जा,
है, बैठना रहता
कमर को आवाजें सुना।
है। सब
कमर नाम ठीक कर अपना यार, जिस तरह बाकी सब का लिखा हुआ है GM4 वैसे लिख तू भी,
टेंशन
स्पेस
ना ले,
खत्म कर दे।
टेंशन ना ले, एक दो एब्सेंट लगेगी ना खुद सेट हो जाएगा।
पता नहीं कितनी
मेरी भी
लग गई
लगी थी
होगी।
पिछली दफा।
भाई तू तो
ओए
क्रेडिट का वो है।
ओए उसामा, मैम कह रही है कि मेरे उसके पास ना मुझे स्क्रीन शॉट सेंड किया है। कहती है कि मेरे पास ना वो चल नहीं रहा मीटिंग। मैं तुम्हें
कर
सेंड
सेंड
करता हूँ
कर।
ग्रुप में।
ब्लैक लिस्ट पे सेंड कर जो मैम ने सेंड करी।
यही थूक
क्या?
से
ये तो तेरे अपने मोबाइल की है बहुत।
वह नहीं है यार। ये दे।
बहुत पहला में काम दे इसके।
फिर
सामने से।
दोबारा मैम ने दोबारा सेंड किया, ये देख।
मैम
मैम का
सेंड
इंटरनेट
करी
ऑफ है और
मैम
इसको पता
क्लास
नहीं
ये
वो
में आई हुई, अब
चिट्ठी
ये कह
भेज
रही
रही है।
मैम सेंड करी, मैम क्लास में आई बैठी है सबसे नीचे, देख कॉन्फ्रेंस में।
इसको
और
मैम
कमर
चिट्ठी भेज रही है।
कमर सबसे नीचे तो मैम बैठी है, तू कह रहा मैम चिट्ठियां भेज रही है।
कब कहाँ बैठी है?
देख जरा नीचे, कमर को देखने देना, तेरी तो ऐनक लगी है। सबसे नीचे बैठी है।
सबने सुना दिया।
हम्म।
मैम को क्या सबने सुना दिया?
अब मैम, उनका माइक बंद है ना, बंद की हुई है मैम ने। आज मैम शुगर लग रही थी, मैम का नेट ही चला गया।
और ये मैम बहुत अच्छी हैं यार।
सारी अच्छी है, कोई बुरी कौन सी है ये बता। किसी न किसी के नाम कोई
ओए
पर्ची
अच्छा,
खाने हो तो फिर तो है भी, सारी अच्छी है भाई।
ओए मेरी बात सुन यार। वो नेक्स्ट क्लास में जो है, ठीक है, उसका क्या करना है? नर्वस
वही
सिस्टम वाले
4
का।
प्रैक्टिस क्लासेस आज 4।
तुम
ओए
नेक्स्ट ना
ओए,
कहो, अगली नेक्स्ट कहो।
यार तू बताना नेक्स्ट क्लास में क्या करना है?
पहले तो
बिलिनरी
तुम
सिस्टम सर ने पढ़ाया है।
यार वो तो तीसरी क्लास है
यार
ना।
तुम्हारे पास सिस्टम है ना, तुम अपना सिस्टम खोल के
नेक्स्ट
जाओ।
क्लास में पता है क्या करना
आया
है?
तो
सर
नहीं मेरी
सर को
बात सुनो
कहना
पहले। पहले
आवाज
जो
नहीं
ओए,
आ रही।
सिस्टम आते हो।
हाँ
अहमद, अहमद यार, ओए अहमद, नेक्स्ट क्लास में वो मैम ने क्या पढ़ाया था जो वो पढ़ा रही थी, वो
यार सेरिबेलम पढ़ाया था।
फिजियोलॉजिस्ट।
सेरिबेलम।
सेरिबेल। अच्छा अच्छा ठीक है।
ये देखना राना पढ़ते हैं साथ में।
हाँ राना
ओए,
पढ़ कर सुनाएगा जो
ए-
मैम ने पढ़ाया था।
एलएमएन सर जो है ना, उनको उनको कहेंगे सर आवाज नहीं आ रही है आपकी।
हाँ, उससे सारे एक एक करके वाकई यूं ही कह देंगे, सर आवाज नहीं
वो
आ
अगला
रही।
होस्ट से
ओए
पूछेगा
मेरी बात
जो
सुनो, मेरी
कोऑर्डिनेटर
बात
होता
सुनो। वो पीएचडी नहीं है वो सर,
क्या?
बदला देगा।
है। मतलब
पीएचडी मतलब PHUDU नहीं है वो।
अच्छा
ओह कोई
अच्छा
मसला
अच्छा
नहीं है,
अच्छा।
हम बना देंगे उसकी,
हाँ।
टेंशन न ले।
एक
वो
दफा
एक ही
कोशिश
क्लास
कर
लेगा मेरे
लेंगे
ख्याल
ना।
से, उसकी ना 2 है प्रैक्टिस क्लासेस, लेकिन लेगा शायद एक ही।
हम उसे
यार
कर लेंगे।
मैम का ना
है ना।
इंटरनल नहीं चल रहा, तो लेफ्ट करो क्लास सर।
अब लेफ्ट पहले मैं करूँ।
करो लेफ्ट।
जा जा, तुझे वॉशरूम आ रहा था, चल।
अब तो इसे रोक
अभी तो
रोक के
कर रहा
तभी
हूँ
तो इसे
पहले।
कब्ज हो जाती है, फिर कहता है कोई गोलियां दे दो मुझे।
हाँ।
यार जल्दी बताओ।
ए यार
सर
हमजा जब आ
पापा
जाएगी
भाई
मैं।
लेफ्ट कर दो।
मैं ना
कर दो
मोबाइल रख
लेफ्ट।
कर जा रहा हूँ।
तू
कोई एक
लेफ्ट
बंदा
करके
होस्ट
बस।
बन के। उसामा एक काम कर, होस्ट बन के क्लास एंड कर दे।
होस्ट बनते कैसे हैं, मुझे बना, मैं कर देता हूँ।
ये देख, मोर में जा, मोर में।
तो इतना तू मुझे बता रहा, तू खुद बन जा।
आ गई मैम, आ
मैम
गई।
आ गई है।
हेलो मैम, हाउ आर यू?
मैम ने जवाब नहीं देना, तू अपना
स्टार्ट
कंटिन्यू
करो
करो
ए।
हसन खान।
हसन
अहमद,
तूने
अहमद
स्टार्ट
सुना।
तुमने
करना
स्टार्ट
स्टार्ट।
कर रिमेनिंग क्वेश्चन आके।
अहमद भाई
मैं करने लगा
स्टार्ट
हूँ
कर यार।
स्टार्ट। हाँ।
ठीक है,
मैम को
कर
कहो
कर।
मैम, टाइमिंग ओवर।
यस मैम अहमद इकबाल।
सुना सुना
Anti
भाई।
antagonists, the most common oral anticoagulatory agents are vitamin K and antagonists such as warfarin and fenfluramine. Anticoagulants are apixaban, viroxaban, idoxaban, batrixaban used for the prevention of thrombosis in several cardiovascular contexts, treating and preventing embolic events. Fibrinolytic drugs are used to break down the thrombus, with the common agents being tenecteplase, retiplase, alteplase, streptokinase, and urokinase. Mechanism of fibrinolytic activity. In fibrinolysis, fibrin clot, the product of coagulation, is broken down. Its main enzyme, plasmin, acts the fibrin mesh at various places, leading to the uh, process of circulating fragments that are cleared by other proteases or by the liver. Features of the action of tissue-activated profibrinolysis. The prostate gland secretes a thin milky fluid that contains calcium citrate, iron phosphate, iron clothing, and profibrinolysin. Also, original secretion of the female acidic sperm do not become optimally motile until the pH of the surrounding fluids rises to about 6 to 6.5. Indications for use and side effects. Common side effects of fibrinolytic agents are hypersensitivity reactions and bleeding. Inhibitor of fibrinolysis factors. The inhibitors, antiplasmins, and anti-activator play an important role in the regulation of plasma fibrinolytic activity and many modify the and may modify the response to fibrin deposits. Next, ma'am, action of aproteinin. Aproteinin is a competitive inhibitor of several serine proteases, specifically trypsin, chymotrypsin, and plasmin at a concentration of about 125,000 and kallikrein at 3 lakh. Its action on kallikrein leads to the inhibition of the formation of factor 12A. Next is a mechanism of action of aminocaproic acid which inhibits both the activity of plasminogen activators and to a lesser degree plasmin activity by binding to lysine binding sites with the plasminogen plasmin molecule which interferes with the ability of plasmin to lyse fibrin chlores. Done, ma'am. Okay.
ओके मैं स्टार्ट करता हूँ नाउ मैम आई विल स्टार्ट टॉपिक 1.4 traditional anticoagulants have antidotes. Heparin can be neutralized by protamine, and warfarin anticoagulation can be reversed by vitamin K injections. An oral anticoagulation contraindication was defined as the presence of one or more of the following, which are severe chronic blood dyscursia, intracranial mass, intracranial hemorrhage, severe major gastrointestinal bleeding, and end-stage liver diseases. Next is fibrinolytic agent, which are used to break down the thrombus, with the common agents being tenestiplase, retiplase, altiplase, streptokinase, and urokinase. Common side effects of fibrinolytic agents are hypersensitivity reactions and bleeding. Next is in fibrinolysis, a fibrin clot, the product of coagulation, is broken down, and its main enzyme, plasmin, cuts the fibrin mesh at various places, which led to the production of circulating fragments that are cleared by other proteases or by the kidney and liver. Next is tissue plasmin tissue plasminogen activator. It is a protein which is involved in the breakdown of blood clots. It is a serine protease which is found on endothelial cells. That cells which line the blood vessels. It is found by aggregation of activated platelets into fibrin meshes by activating plasminogen. More specifically, it cleaves the zymo when plasminogen at its peptide bound to form the serine protease and plasmin. Next is next this drug is used to treat mild to moderate pain from headaches, menstrual periods, toothaches, backaches, and to reduce fever. Some side effects are minor and of little concern, while others may be severe, which require medical attention. Although many side effects are minor and not harmful, and it is important to let your doctor know. Next, sixth question is inhibitors of fibrinolysis. Fibrinolysis is one of the principal defense systems against the development of thrombosis, which is among fibrinolysis factors. The inhibitors, antiplasmins, and anti-activators play an important role in the regulation of plasma fibrinolytic activity and may modify the response to fibrin deposits. Next question is the principle of action of aptorenin and aminocaproic acid with increased fibrinolysis. This drug is used to treat mild to moderate pain and to reduce fever. Some side effects are minor and of little concern, while others may be severe, requiring medical attention. The side effect may be as a sign of danger or that the medication is not working properly. Okay, ma'am. Done. Next.
Now, ma'am Musaddiq. Uh, anticoagulation anticoagulation of anticoagulant protamine sulfate. The anticoagulant activity of protamine has been attributed to inhibition of contact activated and tissue factor induced coagulation. In addition to the well known homeostatic action of protamine in reversing heparin induced anticoagulation, excess protamine can potentially enhance bleeding tendency and anticoagulant of vitamin K. Its name is warfarin. Warfarin is effectively thinning your blood. It's important to eat about the same amount of vitamin K every day. Vitamin K normally helps your blood clot, so wound do not bleed too much. Warfarin works against vitamin K, making your blood clot very slowly. Second question is fibrinolytic drugs. Fibrinolytic drugs are used to break down the thrombus, with the common agent being tenecteplase, retiplase, alteplase, streptokinase, and urokinase. Common side effect of fibrinolytic drugs are hypersensitivity reaction and bleeding. The mechanism of the fibrinolytic drugs is in fibrinolysis. Fibrin clot, the product of coagulation, is broken down. Its main enzyme, plasmin, cuts the fibrin mesh at various places, leading to the production of circulating fragments that are cleared by the proteases or by the kidney and the liver. Mechanism of the action of direct action of some properties of tissue activator plasminogen, improvement in preparation of tissues activators and plasminogens, and termination of activation by epsilon aminocaproic acid have permitted the use of the quantitative seasonality assay for the measurement of the plasmin form. The following data indicates the activation of plasminogen by tissue activator is catalytic biphasic curve obtained when velocity was plotted against plasminogenic concentration. First order kinetics dependence of the turnover number on tissue activation concentration, the temperature and pH stability of tissue activator were similar to those reported for urokinase. Since both of the enzymes have now been shown to activate plasminogen by a catalytic mechanism, these data support the suggestion that urokinase may be an excretory form of tissue activator which has been released into the circulation. Inhibitors of the fibrinolytic drugs. Fibrinolysis is one of the principal defense system against the development of thrombosis. Among us fibrinolysis factor, the inhibitors, antiplasmins, and antiactivators play an important role in the regulation of plasma fibrinolytic activity and may modify the response to fibrin deposits. Antifibrinolytic uh, Antifibrinolytic therapy. Fibrinolysis is a physiological component of hemostasis that function to limit clot formation. However, following trauma or surgery, excessive fibrinolysis may contribute to coagulopathy, bleeding, and inflammatory response. Fibrinolytic agents are increasingly used to reduce bleeding and allogenic blood administration and adverse clinical outcomes. Tranexamic acid is the most excessively studied and used in these factors. This review will explore the role of fibrinolysis as a pathological mechanism. We will focus on the role of tranexamic acid as a therapeutic agent to reduce bleeding in patients following surgery and trauma. Side effects of fibrinolytic drugs are bruising or bleeding at the excessive site, damage to the blood vessels, migration of blood clot to another part of the vascular system, kidney damage in a patient and diabetes or other pre-existing kidney diseases. Fibrinolytic drugs work by activating the fibrinolytic pathway that distinguish them from the anticoagulant drug, which prevents the formation of blood clot by suppressing the synthesis or function of various clotting factors that are normally present in the blood. Okay, ma'am.
मैम नेक्स्ट समझो तो फैल हेलो
अब तुझे सुना सुना
मैम बोलो तो सही क्वेश्चन
नहीं
नंबर 1
स्टार्ट करो
traditional anticoagulants have antidotes heparin can be neutral by protamine and warfarin anticoagulation can be reversed by vitamin K injections and oral anticoagulation contradictions was defined as the presence of one or more of following severe chronic blood and mass intracranial hemorrhage, severe major gastrointestinal bleeding, and end stage of liver diseases. Question number 2. Fibrinolytic agents are used to break down the thrombus, with the common agents being tactoplase, rectoplase, atoplase, streptokinase, and urokinase. Common side effects of fibrinolytic agents are hypersensitivity, reactions, and bleeding by the factors that are used to break down the thrombus with their agents. Question number 3. In fibrolysis of fibrin clot, the product of coagulation is broken down. Its main enzyme plasmin cuts the fibrin mesh at various places, leading to the production of circulating fragments that are cleared by other proteases or by the kidney and liver. And question number 4. Tissue plasminogen activated abbreviated by a protein involved in the breakdown of blood clots. It is a severe protease found on endothelial cells, the cell that line the blood vessels. TPA is thrombolytic, that is break up blood clots found by aggregation of activated platelets into fibrin meshes by activating plasminogens. More specifically, it cleaves the zymogen plasminogen at its peptide bond to form the serine protein plasmin. Line the blood vessels. It is thrombolytic effects on the blood clotting found by aggregations. Question number 5. The drug is used to treat mild to moderate pain from headache, menstrual period, toothaches, back pain, osteoarthritis, rheumatoid arthritis, cold, flu, and other pains, and to reduce fever. Some side effects of these are minor and of little concern, while others may be severe, requiring medical attention. Although many side effects are minor and not harmful, it is important to tell your doctor known as the side effect may be sign of danger or that the medication is not working properly. Question number 5. Fibrinolysis is one of the principal defense systems against the development of thrombosis. Against fibrinolysis, factors are inhibitors, antiplasmins, and anti-activators that play an important role in the regulation of plasma fibrinolytic activity and may modify the response of fibrin deposit that act as a principle on the defense system against the development of thrombosis. Question number 7. Hemostatic agents act as an conserve blood but have differing sites of action in the complex pathway determining coagulation and fibrinolysis. Antifibrinolytics inhibits the activation of plasminogen of plasmin, prevents the breakup of fibrin, and maintain clot stability. They are used to prevent excessive bleeding from the act to conserve blood but have action in complex pathway. Question number 8. The drug used to treat other like paracetamol and others use aspirin. Aspirin is used to treat mild to moderate pain from headaches, menstrual period, tooth osteoarthritis, back pain, cold, flu, other itches, and to reduce fever. And the side effects can be others may be indicated, although many side effects are minor and not harmful, but it is necessary to tell doctor of the other interactions of medicines with them that is very harmful for the causes of disease in other parts of the body. Yes, ma'am, done. Fair.
Yes, ma'am. Rahman Mohammad Dawood. First question is antagonistic of the anticoagulants of direct interaction of antagonists is their antagonistic effect by the vitamin K and its J23X exposed, modulating of the bicarbonation of the glutamic and residues on the N-terminal region of the vitamin K dependent on the protein, including the coagulating factor second, and as well as of the anticoagulants protein C and H, the Y carboxylation is required for the activity of the all above mentioned factors and treatment of the vitamin K as a result of the hepatic production of the partially carboxylated and carboxylated proteins with reduced coagulant activity. Carboxylation allows a calcium-dependent conformation change in such as the coagulation proteins that promotes binding as the cofactor of the phospholipid surfaces, inhibition of the Y carboxylation of the regulatory anticoagulants, protein C and H has the potential to be procoagulant. And next is the fibrinolytic agents are used for thrombolysis, clot breakdown in the several indications, including acute asphyxiation, myocardial infarction, acute pulmonary embolism, and acute ischemic stroke. The pathophysiology of each condition is discussed as well as indication for use of fibrinolytic agents. The pathophysiology of thrombosis and the coagulation cause which comparison of the extrinsic and intrinsic pathway leading to the common pathway are outlined commonly as used. Fibrinolytic agents include canidipase and retiplase and altiplase, streptokinase and urokinase. Next is the mechanism of the fibrinolytic drugs. Fibrinolysis is the process of fibrinolytic digestion of the fibrin amide to dissolving a clot or the thrombus or restore the blood flow. The central enzyme in fibrinolysis is the plasmin. A serine protest formed from the inactive precursor plasminogen upon the action of the activators triggered by various pathologic stimuli. Plasmin cleavage of various substrates other than fibrin is involved in the biological process by node at the hemostasis and the thrombosis. There are a number of mechanisms which moderate the activity of the fibrinolytic enzyme that may become effective in various species. Indication use and adverse side effect of the fibrinolytic drugs. Common adverse of the fibrinolytic drugs is bleeding complications related to the systemic fibrinolysis and the lysis of the normal hemostatic blood. The bleeding is often noted at the gastralization site, although gastrointestinal and cerebral hemorrhage may occur. Therefore, patients who have experienced trauma, injury, or who have a history of the cerebral hemorrhage stroke are not usually administered thrombolytics. Next is the inhibitor of fibrinolytic drugs, antifibrinolytics such as the aminocarporic acid, and tranexamic acid are used to inhibitor of the fibrinolysis. So the application may be beneficial in patients with the hyperfibrinolysis because they have stopped the bleeding rapidly if other components of the hemostatic system are not severely affected. Fibrinol acids are used to break down of the thrombus, with the common agents being taniset and retiplase, antiplase, streptokinase, and urokinase. Common side effect of the fibrinolytic agents are hypersensitivity, reaction, and the bleeding. And its use next is the fibrinolytic indication is used to disrupt clots that have formed in a situation such as acute myocardial infarction, acute ischemic stroke, and massive pulmonary embolism. The fibrinolytic drugs next, the streptokinase and the urokinase, have undergone extensive clinical evaluations in the past 15 years. Current evidence suggests that these agents may become the drugs of choose as a treatment of certain patients with the various thrombosis and the pulmonary embolism. And next is the anticoagulants and of the atropine and monocarpionic acid. Atropine reduces secretion in the mouth and the respiratory passage, relieves the constriction and the spasm of the respiratory passage, and may reduce the paralysis of the respiration, which result from the action of the toxic agent on the central nervous system. Aminocarporic acid inhibit the both of the activity of plasminogen activators and to lesser degree plasmin activate by the binding of the lysine binding sites within the plasminogen plasmin molecule, which interfere the ability of the plasmin to lyse fibrin clots. An indication of the fibrinolytic use that disrupt clots that have may form in the situation such as myocardial infarction, acute ischemic stroke, the massive pulmonary embolism. And side effect of the fibrinolytic drugs may occur as bruising and bleeding as the SS site, damage to the blood vessel, migration of the blood clot to another part of the vascular system, kidney damage in patient with diabetes or other pre-existing kidney disease. Okay, ma'am.